Imagine you're in a doctor's office. Your palms are sweaty and your hands are shaking as you try to focus on something other than the door that your doctor just came in. This is a day that most people dread. Lately you have been having headaches, stomach pain, and nausea, so you decide to see your doctor. However, like most women, you don't expect that the doctor's going to say that you have an STD. Untreated STDs have become an epidemic in women. Mostly because women are afraid to be tested, and they also do not require that their sexual partners wear condoms out of fear that this will make the man that they're with not want to be with them anymore. The three most common STDs are chlamydia, gonorrhea, and HIV. These are among the STDs that are known to have what's called silent symptoms. They're silent symptoms because most of these symptoms do not occur, or if they do, they don't occur until after the damage is done. This is why you must be tested often. Chlamydia is defined as a small parasite that requires another to reproduce. Of 1.3 million cases last year, 700,000 were women. Symptoms of chlamydia include painful urination and abnormal discharge. Although chlamydia is easily cured by antibiotics, it can be harmful if left untreated. It could cause infertility, and if a woman does become pregnant, she can develop what's called ectopic pregnancy, which means that the baby grows in the fallopian tube instead of in the uterus. This can cause not only damage to her ovaries and uterus, it can also cause death. Gonorrhea is the second most common STD in women. 334,826 new cases were reported last year in women between the ages of 14 and 28. Symptoms of this STD is painful urination, vaginal discharge which can be white or yellow, pelvic pain, and fever. If left untreated, it can also cause irregular menstrual cycles, bleeding in between periods, and headaches. And like chlamydia, gonorrhea can also cause infertility. HIV is not only the most common, but also the most deadly of all these STDs. 53% of new cases were found in women. Symptoms are easily missed because if symptoms do occur, they don't occur until years later after infection. Symptoms that may occur be fever, swollen lymph nodes, sore throat, and skin rash. HIV not only affects you momentarily, but it also affects the rest of your life. There's no known cure for HIV. Therefore, once it's contracted, you have to deal with it the rest of your life. You go from being able to take care of your body in simple ways to having to make sure you take your medicine every day. And HIV medicine is also known to be expensive, which means if you cannot afford it, you can easily go from being just HIV positive to full-blown AIDS. Full-blown AIDS is acquired immune deficiency syndrome. It affects the immune system to the point where something as simple as a cold can turn into pneumonia. Thousands of women die from this disease every year. In conclusion, women should be tested for chlamydia, gonorrhea, and HIV. These are the three most common STDs in women every year, which means every woman should be tested yearly. They also should require that their partners wear condoms, especially if they are dealing with more than one sexual partner. Not only should women take care of each other, they also should learn to take care of themselves.